I'm Matsuzaki Asaki, a psychiatrist. Today's topic is changing doctors in charge. Some outpatient clinics change doctors every few years, while others change them every year. In Japan, these changes often happen in April. Such a switch in doctors can often bring feelings of anxiety and uncertainty for patients. Changing doctors in charge has both pros and cons. However, people tend to focus more on the disadvantages. I hope you'll keep in mind that both sides exist. So, let's start with the downsides of changing doctors, the unpleasant parts. It likely goes without saying you felt it yourself. Number one, breakdown in communication of information. When a doctor in charge changes, how much of what was in the previous doctor's mind is actually passed on to the next one? Of course, in many cases, the outgoing doctor writes a handover note or a short summary to convey important information to the new doctor. However, not all information gets passed on and some of it gets lost. It has also been noted that during staff transition periods at medical facilities, the overall efficiency of care tends to decline. That said, with the advancement of electronic medical records and other digital tools, the risk of losing information has been decreasing. And disadvantage number two, you have to rebuild the doctor-patient relationship from scratch. This is especially significant in psychiatry. Having to reset the trust that's been built over time between the doctor and the patient is clearly a disadvantage. And the disadvantage number three, there can be variations in the quality of doctors. The new doctor may not be the same as the previous one. Then, let's go over the benefits of switching doctors. Number one, this one's really important. A fresh perspective in your medical case. When a new doctor takes over, there's a valuable opportunity for a fresh perspective, one that may lead them to notice abnormalities or underlying causes that the previous doctor might have missed. That can be a huge benefit. And advantage number two, the possibility of receiving different treatment options. Different doctors may have different specialties or treatment philosophies. By changing doctors, you may be offered approaches that weren't suggested before, especially in psychiatry. For patients who haven't seen much improvement over time, being seen by a new doctor can offer a valuable opportunity for fresh insight and a different approach to treatment. And advantage number three, standardization of care. Earlier we mentioned that doctors are not all the same as a potential disadvantage. And it's true, some doctors may be less capable or miss important points. But on the other hand, there may be highly skilled doctors whose contributions outweigh the drawbacks. Especially in outpatient clinics where doctors rotate frequently, a mix of less experienced and more skilled physicians, some strong in certain areas, others in different ones, can lead to a kind of balance where treatment becomes more standardized overall. Furthermore, doctors who may be weaker in certain areas often just continue the treatment plan left by the previous doctor. Meanwhile, doctors who are stronger in certain aspects may add something new that wasn't there before. The less capable ones tend to continue what's already in place, and the more capable ones tend to enhance it. By repeating this process, the result can be not just standardization, but an even greater overall benefit. And advantage number four is something that may not feel so relevant on a personal level. It's about the growth of doctors. Young doctors develop their skills through experience at various medical institutions. This process helps raise the overall quality of medical care. And patients like you ultimately benefit from that improved quality in outpatient settings. So while changing doctors does have its downsides, it's also something necessary and valuable. Now for those who regularly attend clinics where doctors change often. It may be less about building a long-term relationship with one doctor and more about appreciating what each individual doctor has offered. One doctor received what I said with a certain kind of understanding. Another doctor suggested a particular treatment that I hadn't considered before. And yet another offered me helpful advice that gave me a new perspective on my situation. Each doctor has contributed something in their own way, and I encourage you to value those experiences. When you see the same doctor continuously, it's often harder to receive such a wide variety of input. Let's stop feeling frustrated when a new doctor doesn't do exactly what the previous one did. It's only natural that they won't, because they're different people. Even if a new doctor doesn't do things the same way as the previous one, they might offer something you haven't received before. Please keep in mind that there may be new opportunities in that. So how can we make the transition to a new doctor go more smoothly? I'll offer two suggestions. They're similar in nature. First, please cooperate moderately in sharing information. Sometimes patients say things like, the previous doctor probably wrote it in the chart, so just read that. But good medical care is built on cooperation between the patient and the doctor. On the other hand, while being cooperative is appreciated, some patients start by saying, since you don't know me, I'll explain everything from the beginning, and go on to share a lot. Especially in outpatient settings, time is limited. Now, what else can you do? Second, keep your explanation concise. The first appointment after a doctor change, if everyone tries to explain everything in detail, the system can get overwhelmed. But saying too little can leave out important information. That's why it's important to focus on the key points when you speak. If needed, write down what you want to say, keep it brief and organized to help communicate more efficiently. I hope this video has been helpful for those who feel anxious about switching doctors in charge. For those whose doctor has recently changed, who knows what kind of doctor you'll meet next? I hope I was able to convey that there are some benefits as well. I also hope you'll make the most of those advantages and build a good relationship with your new doctor. That's all.